Hello, everyone. I'm Tanya Hansen, and welcome back. Today, we're diving deep into one of the most important infectious diseases you must master for the NCLEX, tuberculosis, or TB. TB is not just about memorizing symptoms like chronic cough, night sweats, and weight loss. On the NCLEX, TB questions test your clinical judgment, including infection control and airborne precautions, prioritization and delegation decisions, medication management and toxicity monitoring, public health and ethical responsibilities, recognizing complications such as TB meningitis or drug resistance, patient education and adherence strategies like directly observed therapy or DOT. You must think like a nurse. What is the priority? Who is at highest risk? Which finding requires immediate action? How do we prevent transmission and protect the community? In this session, we'll work through high-level, scenario-based TB questions designed to strengthen your critical thinking and prepare you for real-world nursing practice. Let's sharpen your clinical reasoning and get started. Question 1. A client with suspected active pulmonary TB arrives in the emergency department coughing and without a mask. What is the nurse's immediate priority action? A. Place a surgical mask on the client and move to a negative pressure room. B. Obtain a detailed health history. C. Start oxygen therapy. D. Draw blood cultures. Answer: A. Place a surgical mask on the client and move to a negative pressure room. Rationale: the priority is preventing airborne transmission. The client must immediately wear a surgical mask and be placed in an airborne isolation room. History, oxygen, and cultures are secondary to infection control. Question 2. A hospitalized client with active TB has had 3 consecutive negative sputum smears but continues to have a productive cough. What is the nurse's best action regarding isolation precautions? A. Discontinue airborne precautions. B. Continue airborne precautions until clinical improvement is confirmed. C. Switch to contact precautions only. D. Allow the client to ambulate without a mask. Answer: B. Continue airborne precautions until clinical improvement is confirmed. Rationale: discontinuation requires negative smears plus clinical improvement and provider approval. Persistent cough suggests possible infectivity. Stopping precautions prematurely increases transmission risk. Question 3. A client on isoniazid and rifampin reports fatigue, anorexia, and dark urine. What is the nurse's priority interpretation? A. Possible hepatotoxicity. B. Expected medication effect. C. Dehydration. D. Mild viral illness. Answer: A. Possible hepatotoxicity. Rationale: fatigue, anorexia, and dark urine indicate liver injury. Both INH and rifampin are hepatotoxic. Immediate provider notification is required. The symptoms are not expected, B, nor likely dehydration, C, or viral illness, D. Question 4. A nurse is reviewing chest X-ray results of a client with suspected TB, showing cavitary lesions in the upper lobes. What does this finding most strongly indicate? A. Active pulmonary TB. B. Latent TB infection. C. Healed granuloma. Or D. Pleural effusion only. The answer is A. Active pulmonary TB. Rationale: cavitary upper lobe lesions are classic for active TB due to high oxygen concentration. Latent TB, B, has normal imaging. Healed granuloma, C, appears calcified, not cavitary. Question 5. Which client with TB should the nurse assess first? A. Client with sudden onset shortness of breath and chest pain. B. Client reporting mild nausea from medications. C. Client requesting sleep medication. D. Client asking about discharge planning. Answer: A. Client with sudden onset shortness of breath and chest pain. Rationale: this may indicate pneumothorax or pulmonary embolism, life-threatening complications. ABC priority overrides medication side effects or discharge concerns. Question 6. A nurse is educating a client about preventing TB transmission at home. Which instructions should be included? Select all that apply. A. Sleep in a separate, well-ventilated room. B. Wear a mask when around others during early treatment. C. Stop medication once symptoms improve. D. Cover mouth and nose when coughing. Answer: A, B, and D. Rationale: ventilation and masking reduce airborne spread. Treatment must continue for full duration. C, incorrect. Question 7. A client with HIV has a new positive IGRA test, but no symptoms. What is the nurse's priority recommendation? A. Begin treatment for latent TB infection. B. Repeat the IGRA in 6 months. C. Initiate airborne precautions. D. Schedule immediate bronchoscopy. Answer: A. Begin treatment for latent TB infection. Rationale: immunocompromised clients have high risk of progression to active TB and require treatment. No symptoms mean no airborne isolation is needed. Question 8. True or false? A negative TB skin test definitively rules out TB infection in an immunocompromised client. A. True. B. False. Answer: B. False. Rationale: immunocompromised clients may have false negative results due to anergy. Further evaluation is required if clinical suspicion remains high. Question 9. Yes or no? Should a Ethambutol be discontinued if a client reports difficulty distinguishing red from green colors? A. Yes. B. No. Answer: A. Yes. Rationale: color vision changes indicate optic neuritis, a serious adverse effect requiring immediate discontinuation and provider notification. Question 10. The nurse is delegating care for a client with TB. Which task is appropriate for assistive personnel? A. Remind the client to wear a surgical mask during transport. B. Assess for medication side effects. C. Evaluate sputum culture results. D. Provide discharge medication counseling. Answer: A. Reinforcing mask use is within AP scope. Assessment, evaluation, and education require RN judgment. Question 11. A client on multi-drug TB therapy refuses medications due to nausea. What is the nurse's best initial action? A. Assess severity and timing of nausea. B. Document refusal and leave room. C. Notify law enforcement. D. Discontinue all medications. Answer: A. Assess severity and timing of nausea. Rationale: clinical judgment begins with assessment. Identify cause and implement antiemetic strategies before escalating. Immediate discontinuation increases resistance risk. Question 12. A client with TB develops jaundice and right upper quadrant pain. Which medication is most likely contributing? A. Isoniazid. B. Pyrazinamide. C. Rifampin. D. All of the above. Answer: D. All of the above. Rationale: INH, rifampin, and pyrazinamide are all hepatotoxic. Liver symptoms require urgent evaluation and possible regimen modification. Question 13. Which finding indicates effective TB treatment after 2 months of therapy? A. Conversion of sputum cultures to negative. B. Persistent night sweats. C. Continued weight loss. D. Positive acid-fast bacilli smear. Answer: A. Conversion of sputum cultures to negative. Rationale: culture conversion is the best indicator of treatment success. Persistent symptoms suggest inadequate response. Question 14. A client with active TB insists on leaving the hospital against medical advice while still contagious. What is the nurse's priority action? A. Notify public health authorities immediately. B. Allow discharge without follow-up. C. Physically restrain the client. D. Ignore the situation. Answer: A. Notify public health authorities immediately. Rationale: TB is a public health threat. Authorities may legally mandate isolation to protect the community. Question 15. The nurse evaluates a TB client who has completed therapy. Which finding requires further investigation? A. Mild residual scarring on chest X-ray. B. 3 negative sputum cultures. C. Recurrence of chronic cough. D. Stable weight. Answer: C. Recurrence of chronic cough. Rationale: recurrent cough may indicate relapse or drug resistance. Further evaluation is needed. Residual scarring is common and not necessarily active disease. Question 16. A client with active pulmonary TB receiving RIPE therapy develops platelet count of 60,000 per millimeter cubed and reports easy bruising. Which medication is most likely responsible? A. Rifampin. B. Isoniazid. C. Ethambutol. D. Pyrazinamide. Answer: A. Rifampin. Rationale: rifampin can cause thrombocytopenia leading to bleeding and bruising. INH primarily causes hepatotoxicity and neuropathy. Ethambutol affects vision. Pyrazinamide mainly causes hepatotoxicity and hyperuricemia. Platelet drop is a serious adverse effect, requiring immediate provider notification. Question 17. A nurse is caring for a client with suspected TB meningitis. Which assessment finding requires immediate intervention? A. Nuchal rigidity and photophobia. B. Low-grade fever. C. Persistent dry cough. D. Mild fatigue. Answer: A. Nuchal rigidity and photophobia. Rationale: TB meningitis is life-threatening. Signs of meningeal irritation indicate neurological involvement requiring urgent treatment. Fever and fatigue are expected findings. Cough is unrelated to CNS emergency priority. Question 18. A hospitalized client with TB has been on therapy for 5 days and asks when they are no longer contagious. What is the nurse's best response? A. After 2 to 3 weeks of effective therapy and clinical improvement. B. Immediately after starting medication. C. Once fever resolves. D. When chest X-ray is normal. Answer: A. After 2 to 3 weeks of effective therapy and clinical improvement. Rationale: infectivity usually decreases after 2 to 3 weeks of effective treatment with negative sputum smears and clinical improvement. One dose or fever resolution is insufficient. Chest X-ray changes may persist despite non-infectivity. Question 19. A nurse reviews labs for a client taking pyrazinamide. Which value requires follow-up? A. Uric acid 9.5 milligrams per deciliter. B. Sodium 138 MEq per L. C. Hemoglobin 13 grams per deciliter. D. Potassium 4.0 MEq per L. Answer: A. Uric acid 9.5 milligrams per deciliter. Rationale: pyrazinamide causes hyperuricemia, increasing risk for gout. Elevated uric acid requires monitoring and possible treatment adjustment. Other values are within normal limits. Question 20. The nurse is caring for 4 clients. Which client should be placed in airborne isolation immediately? A. Clients with chronic cough, weight loss, and night sweats. B. Clients with influenza and fever. C. Client with COPD exacerbation. D. Clients with bacterial pneumonia on antibiotics. Answer: A. Clients with chronic cough, weight loss, and night sweats. Rationale: classic TB symptoms require immediate airborne isolation pending confirmation. Influenza requires droplet precautions. COPD and treated pneumonia do not require airborne precautions. Question 21. A client receiving TB treatment reports tingling in hands and feet. What is the nurse's priority intervention? A. Administer prescribed pyridoxine. B. Discontinue all TB medications. C. Encourage increased fluid intake. D. Apply warm compresses. Answer: A. Administer prescribed pyridoxine. Rationale: peripheral neuropathy is a side effect of isoniazid. Vitamin B6 prevents and treats neuropathy. Discontinuing therapy risks resistance. Supportive measures alone are insufficient. Question 22. Select all that apply. Which populations are at increased risk for progression from latent TB to active TB? A. Clients with HIV infection. B. Clients receiving long-term corticosteroids. C. Clients with poorly controlled diabetes. D. Healthy young adults with no comorbidities. Answer: A. Clients with HIV infection. B. Clients receiving long-term corticosteroids. C. Clients with poorly controlled diabetes. Rationale: immunosuppression, HIV, steroids, and chronic conditions like diabetes increase progression risk. Healthy individuals without risk factors have lower progression risk. Question 23. True or false? A negative acid-fast bacilli smear definitively rules out active pulmonary TB. A. True. B. False. Answer: B. False. Rationale: a negative smear does not rule out TB. Culture and molecular testing are more sensitive. Clinical suspicion may warrant continued isolation despite negative smear. Question 24. Yes or no? Should a nurse wear an N95 respirator when entering a negative pressure room of a client with active TB? A. Yes. B. No. Answer: A. Yes. Rationale: airborne precautions require properly fitted N95 respirators for healthcare workers to prevent inhalation of droplet nuclei. Question 25. A client with multi-drug-resistant TB, MDR TB, is non-adherent to therapy. Which action is the nurse's highest priority? A. Coordinate directly observed therapy with public health services. B. Educate once and allow independent management. C. Reduce the number of prescribed medications. D. Discontinue isolation precautions. Answer: A. Coordinate directly observed therapy with public health services. Rationale: MDR TB poses major public health risk. Strict adherence through DOT is essential to prevent further resistance and community spread. Reducing medications worsens resistance. Isolation cannot be discontinued while contagious. Question 26. A 54-year-old client with active pulmonary TB on day 10 of RIPE therapy reports sudden onset of blurred vision and difficulty reading. What is the nurse's priority action? A. Hold ethambutol and notify the provider immediately. B. Reassure the client that vision changes are temporary. C. Encourage the client to rest eyes for 24 hours. D. Administer prescribed paradoxine. Answer: A. Hold ethambutol and notify the provider immediately. Rationale: ethambutol can cause optic neuritis, presenting as blurred vision and color discrimination issues. Immediate discontinuation prevents permanent damage. Reassurance: B. Delays treatment. Rest: C. Does not address toxicity. Paradoxine: D. Treats INH-related neuropathy, not vision changes. Question 27. A client with suspected TB presents with productive cough, weight loss, night sweats, and oxygen saturation of 88% on room air. Which action should the nurse implement first? A. Apply oxygen via nasal cannula. B. Initiate airborne isolation precautions. C. Obtain sputum sample for acid-fast bacilli. D. Perform full head-to-toe assessment. Answer: B. Initiate airborne isolation precautions. Rationale: even though oxygen saturation is low, preventing airborne transmission is the immediate priority for public safety. Oxygen can be applied after isolation measures are in place. Sputum collection and full assessment follow infection control implementation. Question 28. A nurse supervises a team caring for a client with active TB. Which task is appropriate to delegate to a licensed practical nurse? A. Administer scheduled oral anti-TB medications. B. Develop discharge teaching plan. C. Interpret sputum culture results. D. Assess for signs of medication toxicity. Answer: A. Administer scheduled oral anti-TB medications. Rationale: LPNs can administer routine oral medications. Teaching plan development, lab interpretation, and toxicity assessment require RN-level clinical judgment. Question 29. A client with latent TB infection asks why treatment is necessary if they have no symptoms. What is the nurse's best response? A. Treatment prevents progression to active TB disease. B. It is required for hospital policy. C. You are currently contagious. D. It shortens isolation time. Answer A. Treatment prevents progression to active TB disease. Rationale: latent TB can progress to active TB, especially in immunocompromised individuals. The client is not contagious. C. Incorrect. Hospital policy. B. Is not the reason. Isolation is not required for latent TB. D. Incorrect. Question 30. Select all that apply. A client with active TB is being discharged home. Which instructions should the nurse include? A. Complete the full course of prescribed medications. B. Attend all follow-up sputum testing appointments. C. Avoid close contact with others until cleared by provider. D. Stop medication if side effects occur. Answer A. Complete the full course of prescribed medications. B. Attend all follow-up sputum testing appointments. C. Avoid close contact with others until cleared by provider. Rationale: full adherence prevents resistance. Follow-up confirms treatment success. Limiting exposure protects others. Medications should not be stopped without provider guidance. D. Incorrect. Question 31. A client with confirmed TB refuses treatment due to cultural beliefs. The client remains contagious. What is the nurse's most appropriate action? A. Notify public health authorities per protocol. B. Respect the refusal without further action. C. Administer medications without consent. D. Discharge the client immediately. Answer A. Notify public health authorities per protocol. Rationale: TB is a reportable communicable disease. Public health authorities may mandate treatment to protect the community. Respecting refusal alone risks transmission. Forced medication without legal authority is inappropriate. Question 32. A client on TB therapy develops acute shortness of breath, pleuritic chest pain, and decreased breath sounds on one side. What complication should the nurse suspect? A. Spontaneous pneumothorax. B. Medication allergy. C. Hyperuricemia. D. Peripheral neuropathy. Answer A. Spontaneous pneumothorax. Rationale: cavitary TB lesions can rupture, causing pneumothorax. Sudden dyspnea and unilateral decreased breath sounds indicate lung collapse. Other options do not explain respiratory distress. Question 33. True or false? A client with extrapulmonary TB of the kidney requires airborne precautions if there is no pulmonary involvement. A. True. B. False. Answer B. False. Rationale: airborne precautions are required for pulmonary or laryngeal TB. Extrapulmonary TB without lung involvement is generally not contagious via airborne route. Question 34. Yes or no? Should corticosteroid therapy be considered in clients with TB meningitis to reduce inflammation and neurologic complications? A. Yes. B. No. Answer A. Yes. Rationale: adjunct corticosteroids reduce inflammatory damage and improve outcomes in TB meningitis. Question 35. A client with MDR TB on second-line therapy reports hearing loss and tinnitus. Which medication toxicity should the nurse suspect? A. Aminoglycoside-induced autotoxicity. B. Rifampin-induced thrombocytopenia. C. Isoniazid-induced neuropathy. D. Pyrazinamide-induced hyperuricemia. Answer A. Aminoglycoside-induced autotoxicity. Rationale: second-line drugs for MDR TB often include injectable aminoglycosides like amikacin, which can cause autotoxicity. Hearing loss requires immediate evaluation to prevent permanent damage. Other options do not cause auditory toxicity. Question 36. A client with active TB has been receiving therapy for 3 weeks. Today, the client's sputum smear is positive after previously trending downward, and the client admits missing several doses. What is the nurse's priority concern? A. Development of drug resistance. B. Expected fluctuation in results. C. Medication overdose. D. Allergic reaction. Answer A. Development of drug resistance. Rationale: missed doses increase the risk of multi-drug-resistant TB. A rising smear after non-adherence suggests treatment failure or resistance. This is not a normal fluctuation. B. Overdose, C, would present differently. Allergic reactions, D, do not cause positive smears. Question 37. A client with active TB is scheduled for transport to radiology. Which action is most appropriate? A. Have the client wear a surgical mask during transport. B. The nurse wears only gloves. C. Remove airborne precautions before leaving the room. D. Schedule transport at the end of the day without precautions. Answer: A. Have the client wear a surgical mask during transport. Rationale: when leaving a negative pressure room, the client must wear a surgical mask to prevent airborne spread. Airborne precautions are maintained. Gloves alone are insufficient. Timing transport does not eliminate risk. Question 38. Select all that apply. A client with newly diagnosed TB has laboratory findings pending. Which factors increase the likelihood of multi-drug resistant TB? A. Previous incomplete TB treatment. B. Close contact with known MDR TB case. C. Residence in an area with high TB prevalence. D. First-time TB diagnosis with full adherence expected. Answer: A. Previous incomplete TB treatment. B. Close contact with known MDR TB case. C. Residence in an area with high TB prevalence. Rationale: prior incomplete therapy is the strongest risk factor for resistance. Exposure to MDR TB and living in high prevalence regions increase risk. A first-time fully adherent client has lower risk. Question 39. A client receiving long-term TB therapy reports joint pain and swelling in the great toe. Which medication effect should the nurse suspect? A. Hyperuricemia from pyrazinamide. B. Peripheral neuropathy from isoniazid. C. Optic neuritis from ethambutol. D. Thrombocytopenia from rifampin. Answer: A. Hyperuricemia from pyrazinamide. Rationale: pyrazinamide increases uric acid levels, leading to gout-like symptoms such as toe pain and swelling. The other medications cause different toxicities unrelated to acute joint inflammation. Question 40. A nurse receives report on 4 clients. Which client requires immediate assessment? A. Client with TB who reports new onset confusion and lethargy. B. Client with TB requesting antiemetic medication. C. Client with TB awaiting sputum collection. D. Client with TB asking about diet options. Answer: A. Client with TB who reports new onset confusion and lethargy. Rationale: new neurological changes may indicate hypoxia, TB meningitis, or medication toxicity and require immediate evaluation. Requests for antiemetics, sputum collection, or diet teaching are lower priority compared to potential neurological compromise.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!